is devastated situation. Number two, the health standard of Bangladesh is out of question. Nowhere in the world Bangladesh health standard can compare, but the pharmacy sector is doing good. My question would be to you very directly, and I will give you enough time to clarify. Do you think the health sector should get more focus from the government side, from the side of the specialists like you, even from the public side, to increase, because human life is very important?
No, thank you, Mr. Kanchan. Yes, the corruption in health sector is a very well talked actually issue in Bangladesh for a long time. But during the COVID, it actually surfaced a little bit more ugly way, that during that actually severe situation, people were doing corruption to purchase things or to give any things like that. So, yes, corruption is one of the important hindrances in providing good healthcare services in Bangladesh, and the corruption actually is part of the corruption of the whole country. It is not different, you can say, but actually it affects a lot, and people who actually do the major corruption, they are from the ministry. Even we have already seen that the ministers were directly involved, even the secretaries and the other administrative people whom actually we thought that they will actually be more transparent, more actually committed to the people, but we are seeing it quite different. And the major actually corruption occurs through the ministry, through the vendors. They are always very powerful, very influential. They actually always be with the government. They are always they have very
strong
connection with the government. So, at the directorate level or even in the ministry level, they do not care anyone, and they can actually compel them to do whatever they want. I worked in the directorate, though it was earlier, but during that time I found it, especially say for example in the hospitals.
Sir, according to you, the minister himself, government itself, the DGs themselves, the secretary themselves are doing corruption with the nexus of vendors. It is a public money, people's tax paid money, foreign aids and loans. Are they above law?
At least during the past time, you can say that they were above laws, and actually none was made head responsible during that time, you know. But actually they should not be above law. We want that actually system now, that gradually the country will run in such a system that there is democracy. People have to actually be responsible to someone. Say for example, the
sir, I want to take the answer from you to our international affairs commentator. He is a young generation. He belongs young generation. Sir, you heard that a person like Professor Dr. Benazir Ahmed says that corruption is acknowledged. Regarding the healthcare standard in Bangladesh and rest of the world, our international affairs commentator already has given some examples about the Thailand, Singapore, Malaysia and other countries including Bhutan, that their healthcare standard is far ahead than us. Why we are so much of behind of world health standard including South Asia? We did not spend less money for the development of healthcare, sir?
Actually, 2-3 things are there. One thing, it is a, you can say, paradox. The health system or health achievement or the health status of Bangladesh is a paradox. On one hand, there are a lot of discrepancies, lot of irregularities, a lot of things not achieved. On the other hand, we have achieved a lot in many areas, especially in public health. We have very good achievement. If you say about, say for example, EPI vaccination, 70% the coverage is very high and consistently high for long time, and has been awarded. The country has been awarded for vaccine, and 10 vaccines are given against 10 diseases, childhood diseases, that could actually claim about say 200, 300,000 lives every year that we could avoid during the last 30, 40 years. So, that is a huge achievement. We have actually eliminated visceral leishmaniasis or Kala Jar. It is the first country in the world who actually achieved the elimination. It is a public health elimination though, not a we call transmission elimination, not yet we have achieved. Also we have achieved elimination of filariasis. So, far ahead of India or other neighboring countries. So, it is one area that Bangladesh has been doing good. On the other hand, if you think about the curative service of Bangladesh, there are a lot of actually extortion, lot of low qualities, the service is not of quality, people are not satisfied, and sometimes we are telling that the investment of intelligent physicians in health sector is a misuse or loss in our country. We could actually expect better physicians than India, Nepal or other countries, as the brilliant students are going to health, but it is not happening. Why? The system is not working. If we could actually establish a good system, say for example, few things are vital. One is referral. Referral is not happening, number one. Number two, say drug selling without prescription. It is happening, and so that the quack, the drug seller, they are selling antibiotics that could be actually prescribed only by senior physicians.
So, sir, according to you, there are a lot of areas to concentrate.
True.
There are a lot of areas to invest. Bangladesh Meteorological Department warns a heavy monsoon rain in central part of Bangladesh and eastern part, especially as you mentioned the Feni, Gorai Nodi and other parts like hilly areas. So, what kind of preparation health department should have to face the health hazards in flood situation?
No, actually the monsoon started earlier in Bangladesh and in the South Asia we are seeing, and that has an impact especially on dengue. And along with that other Aedes borne disease chikungunya. So, that has been occurring in Bangladesh, and already it has been actually affecting lot of peoples now outside the Dhaka. Say for example, out of 100, 20% patients are coming from Dhaka and 80% are coming from the urban areas of the other parts of the country. There are small districts like that, Barguna one of them like that. So, actually during this season we are actually concerned regarding a huge outbreak of dengue throughout the country. The pattern of rain is very suitable for breeding of Aedes mosquito, and Aedes has actually gone to all parts of the country, and also the virus is available everywhere, because Bangladesh is a small country, people are moving from one area to another area frequently for different regions. So, both the virus and vector are there. So, we are actually concerned regarding a huge outbreak of dengue, and that will happen in the rural areas where the preventive system is very low, very weak in comparison to Dhaka and other city corporations. You can say about Barguna, you can think about Gaibandha, you can think about
the country as
even smaller areas. So, and there is actually less feasibility to have detection of the disease, and also the management system including physicians, nurses and the equipment and logistics, these are not also sufficient. So, we are actually concerned about huge number of attack and death also.
According to you, I just need a good advice from you for the interim government or Ministry of Health Affairs or Director General's Office of Health Affairs, as problem is ahead. We are gazing after post flood, we will have to be very careful. What would be your advice?
No, already I have some talk with Secretary, Ministry of Local Government and also the Directorate people. I told them there are two actually preparations we need. One is the local government should actually instruct all the Purushabhas, all the union parishads to actually take preparations, at least minimum preparation to prevent dengue. So this is on part of the local government. On part of the health, they have to actually take mass preparation, but the situation is that the ministry or the directorate have not the fund. So I would request actually the interim government to allocate, I think, adequate fund to procure the diagnostics, to procure the IV fluids and other things that needed to actually manage the dengue patient. Otherwise, people will have great sufferings and we shall lose some valuable lives also.